I'm very happy to be here at the Norfolk Public Library. As you know, the Norfolk Senior Center has been out of commission for the past 3 months. So we're very grateful to the library for hosting us, and I'm also very grateful to Norfolk Cable Television for recording this program, because they've just been a fabulous resource for us. So thank you again for being here, and I'm very pleased to welcome Susan Flanagan with Blue Cross and Blue Shield, who will be doing a presentation on Medicare, Countdown to 65. Thank you.
Great. Thank you, Kathleen, so much for having me and the Norfolk Public Library, Norfolk Council on Aging. I appreciate the opportunity. Thanks, everybody, for coming. The presentation that I'm going to do is about 50 to 60 minutes long. It's a lot of information to cover, but we'll take it one topic at a time. After each topic, I'm going to stop, see if you have any questions. What I always like to say is that the presentation is really kind of broken into 2 parts. We have the first part, which is all about Medicare and the types of plans that go along with Medicare. Now, I'm from Blue Cross, but there won't be any Blue Cross product-specific information in here. It's really to try to answer some of those questions of, as you approach Medicare, when and how to enroll. Once you're on Medicare, what does Medicare cover? What are the types of plans that go along with Medicare? And once you have that information, then you'll be able to look at the product information when you're closer to the date and really make sense of the plans that are available to you. I also always say that the good news in the Medicare section is that once you go on to Medicare, most people can find a plan that they really, bless you, that really meets their needs and like. So it's a lot of information to go through, but once you find that plan, you're typically very happy with the plans available to you. Now, the second section only takes about 5 minutes to go through, so that's the good news. There's not a lot of detail to go through, but the bad news is that typically that section, if you need coverage before Medicare eligibility, there's not a lot of options, and it's typically a very expensive time for a lot of people. So we'll go through both sections, but we are going to start with Medicare because that is where all the detail lies. And this slide right here is really a high-level overview of what we're going to talk about, but it's also a good visual of the choices that you have once you go on to Medicare. We will take, again, each one of those boxes one at a time, but what this slide is showing you is that when you go on to Medicare, that's your starting point. And a very oversimplification of Medicare is that it's an 80-20 plan. Medicare covers you 80%, you pay 20%. There's some deductibles. Any doctor, any hospital, it takes Medicare. You could stop right there and do nothing else. But if you want more coverage than Medicare, your first question is always going to be, if you're leaving an employer plan, ask them, do I have retiree medical coverage when I leave? So did you work for the federal government, the state, a company for 20 years? You don't want to leave something on the table, because typically if they're offering retiree coverage, you usually need to take it when you're leaving or you lose out on it forever. So you always want to ask that question. But for most people, they're not going to have that coverage through a former employer. They're going to have to go out and buy insurance on their own. And if you do, there's 2 distinct pathways for you to go down to get that additional coverage. After we talk about Medicare, we'll start to talk about the Medicare supplement plans. Those are plans that you buy through a private insurance company, and they pick up the 20% that Medicare left behind. They don't add in a lot of extras that Medicare doesn't cover, so you're not seeing money towards glasses, dental cleanings, and you can see that you'd have to buy a separate prescription drug plan. That's typically the most expensive monthly pathway to go down, but the least amount of money as you see those doctors in hospitals. So that's one way of doing things. Now, in the middle of the page is the or. So you never do both pathways, one or the other. And the next pathway are called Medicare Advantage plans, sometimes Medicare Part C or optional replacements to Medicare. These are your Medicare HMOs and PPOs. These are the plans that you're seeing on TV all the time, that zero premium, endorsed by celebrity, Joe Namath, William Shatner, whoever you can think of, medical, prescriptions, money towards glasses, dental cleanings, and those can range anywhere from $0 to about $200-something a month. Most popular plans on the Medicare Advantage side are $0 to $100. So on these plans, you want to think about lower monthly premium, extra benefits, but pay as you go, some co-payments. And we'll talk about how those plans are funded, because a lot of times people have a question, well, how can you get something for nothing? So we certainly get some funding to administer those plans. So we're going to start, though, with Medicare, because what we find is if you understand Medicare, everything else makes a lot more sense. So Medicare is health insurance provided by the federal government. It's broken down into two parts. We have Medicare Part A and Medicare Part B. When you think about Part A, you want to think about your hospitalization and skilled nursing. And when I say hospitalization, what I mean by that is it's the room and board, the lab, the equipment, everything you're doing in that hospital minus your doctor care. So doctor care always falls under Medicare Part B. Part B is all of your doctor care, whether you're in or out of the hospital, and all of your outpatient services, your labs, your x-rays, MRIs. Part A is premium free. You've paid into the system throughout your life. And Part B is $164.90 per person per month for most people. So if you're collecting Social Security, your Medicare premium is going to come automatically out of your Social Security check. But sometimes people are going to go on to Medicare at 65, and maybe you're not going to collect until you're 70. That's no problem. You'll work it out with Social Security to pay that monthly premium. With Medicare, as I said, you can go to any doctor, any hospital that takes Medicare, and most do. You don't need referrals, so if you want to see a dermatologist, cardiologist, you have the freedom to do that. Works the same in Massachusetts as it would anywhere nationwide. And again, really oversimplification, we'll see some slides on it, but 80-20 plan, Medicare paying 80, member paying 20, some deductibles, any doctor, any hospital that takes Medicare, no referral. So on the next two slides, we are going to talk about when and how to enroll into Medicare, and that's where we have a lot of questions, because as soon as you're turning age 65 or approaching that time frame, you probably have friends telling you you have to take Medicare, which may or may not be true. I'm sure you're inundated with materials. So really the question when to enroll or how is a personal one, but most people can find themselves in one of the next three categories that I'll go through. So the first one would be if you're turning 65 and you're already collecting Social Security, then your Medicare card should come automatically to you about 2 to 3 months prior to your 65th birthday to start the first day of the month of your 65th birthday. So let's say you were born September 20th, your Medicare would start September 1st, and you would have seen that card come automatically a few months prior. If you were born on the 1st of the month, Medicare always has an exception. So let's say you were born on September 1st, Medicare would have started you August 1st, starts you the 1st of the previous month. But nice and easy, if you're collecting, it's going to come automatically to you. If you're not collecting and you're turning 65 and you want your Medicare to begin, nothing happens automatically. So you do need to initiate that process. And you would do that about 2 to 3 months prior to your 65th birthday. So it starts the first day of the month of your 65th birthday. You also have the month of and 3 months after to start that process, but it's not ever going to backdate. There'll be a delay in your effective date. And then the last group of people would be somebody that says, well, I'm going to continue to work past age 65, or my spouse is continuing to work past age 65, and I have insurance through that employer. Do you need to take Medicare in that situation? It's going to depend on the size of their employer. So if the employer is 20 or more employees, you don't have to do anything. It's the same as if you're 19, 18, 70, everybody's treated the same. So your employer plan would always be primary. If you wanted to take Medicare Part A is premium free. If you ever end up in the hospital, there might be some coordination of benefits. Again, your employer plan's still going to pay first. You're really not going to want to take Medicare Part B because you'd be paying that premium. And again, your employer plan's going to be primary. So Part B really wouldn't do anything for you. So if you're working past age 65, actively working with insurance through that employer, there's no need to do anything. You're not going to be penalized. When you know you're leaving that employer coverage or losing that coverage, you're going to contact Social Security. You're going to say, give me Medicare Parts A and B, or just Part B if you took A. They're going to say, well, where were you at age 65? You're going to say, I was actively working with insurance through my employer. They'll have a form for your employer to fill out, and you won't have any type of penalty. There is something I do want to mention here, though. If you are working past age 65 and you have a high deductible plan and you paired it with an HSA, which is a health savings account, so you're taking pre-tax dollars out, you want to be aware that Medicare recommends you stop contributing to that HSA 6 months prior to going on to Medicare. And the reason would be, let's say you would say, I'm going to work until I'm 70, and July 1st, that's when I'm retiring. So you go to Medicare and you say, give me Medicare A and B for July 1st. They're going to give you your Medicare Part B effective July 1st, but they always backdate the Part A 6 months. So if you had a high deductible plan paired with an HSA, you're going to have Part A for 6 months while you're contributing to that HSA. So you want to keep that in mind. And the last thing to mention on the slide is if you're working for a company with less than 20 employees, most likely the rules are different and you do need to take that Medicare A and B. So I'm going to stop right here and see if there's any questions on really when and how to enroll into Medicare.
I think I'd like to have a little more, maybe a repeat of the HSA high deductible. So if you, is there, like if you accept it, if you take the Medicare A, you should stop doing the HSA?
Yes.
All right, so if you don't want to stop the HSA,
just don't take, yep, you got it, yep.
All right.
So most people, when they turn 65, if they're still actively working with insurance, most people are kind of in a habit of taking Medicare Part A. I'm going to take Part A, it's free, I'm going to get in the system, I'll wait for Part B, and that's perfectly fine. A is not going to hurt you, with that one exception. If you have a high deductible plan and you've paired it with an HSA, you want to continue to contribute to the HSA, just don't sign up for Part A. So, and then you're all set. You can continue to contribute to that HSA.
Is there a benefit for having your personal, your insurance for your employer and the Medicare?
Really? Is there a benefit? Yeah. Not always. Like if you take the Part A, sometimes if you end up in the hospital, that Part A might fill in some of the deductible, and we'll see that coming up if you have a high deductible plan. But other than that, there's really not. So you're welcome.
And so if we continue that, you can go under your own insurance for Medicare if you're still working?
If you're still working, company 20 or more employees, and you have the coverage through that active employment status. So you can just stay on that as long as you want. And then once you stop working or retire or lose the coverage, that's when you're going to call Social Security and get on Medicare.
But you still have to sign up or you get a penalty. So
you're going to have to sign up at that time or you would get a penalty. Yep. So what does Medicare cover? So if you only had Medicare and nothing else, and you went into the hospital, Medicare is going to cover you the first 60 days after you paid an initial deductible of $1,600. So whether you're in the hospital 1 day or 60 days, when you leave that hospital, you'd get a bill for $1,600. If you were there for more than 60 days, at day 61, you start to pay $400 a day, and at day 91, you start to pay $800 a day. Also under Medicare Part A is the skilled nursing facility. You do need to be admitted in the hospital 3 days prior for this benefit, but as long as you have that, Medicare covers you the first 20 days at 100%, but day 21 through day 100, you would pay $200 a day. So this is Medicare alone. And Part A of Medicare works off of what we call a benefit period. And a benefit period starts the day that you enter that facility and ends when you've been out for 60 consecutive days. So an example might be, go to the hospital, you're there 10 days, you left the hospital, you're gonna get that bill for $1,600. If you went home for a few days and you went back into the hospital, you're not gonna pay that deductible again. Example, if you were there 10 days, now they're gonna start picking up day 11, day 12, day 13. But as soon as you go home for 60 consecutive days, so let's say you're home 4 or 5 months, you go back in, everything resets, even if it's the same calendar year, day 1, day 2, day 3, and that's how you would pay that deductible again. Also under Part B of Medicare, this is all of your doctor care and your outpatient services. Medicare Part B has a calendar year deductible of $226. Once you've met that, then Medicare covers you at 80% and you pay 20%. So an example here might be, you come on to Medicare, you see a doctor, they charge $500. Eventually you're gonna get a bill for $226. Then you've met that deductible for the year, you're never gonna pay it again, and then Medicare is really that 80-20 plan that we mentioned earlier. It does not cover outpatient prescription drugs. We'll talk about that in a little bit. It covers you anywhere in the US and our territories, but not worldwide. It doesn't add in routine vision, dental, or hearing. So that was a quick rundown of Medicare, and when you do go on to Medicare, you'll get a big Medicare and You handbooklet that will spell out all that information, and you will get that every year once you're on Medicare, sometime September, October. Any last questions on Medicare? No? Okay. So you could say, I'm going to stop right there and do nothing else. I like Medicare, 80-20 plan, any doctor, any hospital, no referral. Or you might say, you know what, I don't want to be stuck with that 20% that Medicare left behind. And if that's the case, now we're going down that first pathway of talking about Medigap or Medicare supplement plans. These are plans that you're buying from a private insurer like Blue Cross or somebody else that are picking up the 20% where Medicare left off. If you've done some reading, you've seen the term Medigap, Medicare supplement. Those two terms are used interchangeably all the time. It's really confusing with the terminology. They mean exactly the same thing. They're a type of plan that fills in the gaps where Medicare left off or supplements where Medicare left off. So no matter which Medigap plan you pick, they're always going to pick up the 20% that Medicare left behind, but there's a couple different options and they're going to pick up different deductibles, and we'll see that. When you join one of these plans and you go to the doctors or the hospitals, you always show 2 cards. You show your Medicare card and then your health plan card. What's going to happen is the doctor's going to bill Medicare, Medicare is going to pay its share, whatever's left over goes back to the doctor's office. If you didn't have health insurance, they would bill you the leftover amount. If you have a Medigap plan, they're billing the Medigap plan the leftover amount. So Medicare is primary, health plan is secondary. Which that means to you is that you're not calling Blue Cross or a different company saying, where's your provider directory booklet? Is this benefit covered? If Medicare covers the benefit, the plan's there to just pick up where Medicare left off. You can go to any doctor, any hospital that takes Medicare. In Massachusetts, we have 3 types of plans, and they're regulated by the Division of Insurance. They're called Supplement Core, Supplement 1A, and Supplement 1. You can buy those through Blue Cross, you can buy those through other carriers. They're regulated benefits, so you'll never have less than what's on this board. Carriers may have different premiums because they have different membership, but you'll never have less than what's here. The pricing starts on the Supplement Core around $130 per person per month. The Supplement 1A would start around $190 per person per month, and the Supplement 1 around $230 per person per month. The Supplement 1 plan is the easiest plan to understand. All you have to do to understand that plan is to know that if Medicare covered the benefit, the Supplement 1 plan covers it at 100% and leaves you nothing to pay out of your own pocket. So every time you see a check mark, it means there's no cost for your care. So essentially on the Supplement 1, you go to the doctor, hospital, lab, x-ray, MRI. Medicare pays first, health plan pays second. There's no cost for you. The cost is the premium. So on that plan, let's say it's $230, you're going to do $230 times 12. That's the cost of your Medicare covered services that year, whether you have $10 million of claims or zero. So very predictable cost. The Supplement 1A plan, same thing, minus you're going to pay the Part B deductible each year. And in 2023, that is $226. So in that example, you're going to pay your first $226, but after that, every time you go to the doctor, lab, x-ray, hospitalization, all covered at 100%. So again, predictable costs, $190 times 12 plus $226. And the last one, the Supplement Core plan, it starts around $130. This plan is going to leave you some of those deductibles. So if you go into the hospital on this plan, you're going to pay the $1,600, skilled nursing at day 21. You pay the Part B deductible each year, the $226. But after that, every time you go to the doctor, lab, x-ray, you're covered at 100%. None of these plans include prescription drug coverage. So back to that model, you're going to do Medicare, supplement, and if you want drug coverage, it's going to be a separate company for your prescriptions or separate plan. Care outside the U.S. Medicare only covers you in the U.S. The 1A and the 1 are regulated to cover you worldwide. Typically, if you're receiving care outside the U.S., you're going to have to pay upfront, come back, get reimbursed. The Core doesn't have a check mark. It's not regulated to cover you outside the U.S. At Blue Cross, we do. So if you're looking at our plan, we would have a check mark there. Many of the other carriers also would cover you outside the U.S. But I just want you to know what the minimum standard is on all of these plans. To be eligible for these plans, you just need to be a Massachusetts resident with Medicare Parts A and Part B. There's no pre-existing conditions or health screenings. On the Supplement 1 plan, there is an additional requirement that you were eligible for Medicare prior to 1/1/2020. So that means you were age 65 before that date, or you were eligible through disability. So many of you in here would not be choosing the Supplement 1. You would choose between the Core and the 1A. That's, if you have heard Blue Cross brands it, and we call the Supplement 1 MedX Bronze. Yep.
I have family members who have it. It was great.
Yeah.
But we can't get it now.
You know, when you do the math out, let's say the Bronze for Blue Cross or Supplement 1, it's around $230, but the Supplement 1A, it's $190 or so, plus the $226. So at the end of the day, you're actually financially better off on the Sapphire. But some people just like that no hassle ever thinking about a bill. So that would be, we brand it at Blue Cross, the Supplement 1A, and we call it MedX Sapphire. Yep.
And then the Core, you said, was how much?
About $130 per person per month. So these plans are continuous open enrollment. If you only have Medicare, you can come on them at any time. Whenever we receive your application, you'd be effective the first of the following month. If you're on, let's say you choose the Supplement Core, you say, I haven't been in the hospital in 30 years, I'm going to take my chances. And all of a sudden your health changes, you can move up to the 1A. And then if you're on the 1A and you say, I want to move back to the Core, you can do that. It always is effective the first of the following month that you call. So you say, you're on the Core, I'm on my way to the hospital, I'm going to call Blue Cross or call whoever and go to the Supplement 1 so I don't have to pay that hospital deductible. Well, it's the same month. You're going to have to pay that deductible. But they'll switch you for the first of the following month. So in the other example, if you are on the core and all of a sudden your health changes and your doctor says you're going to need a surgery next month, you're going to have to be admitted in the hospital, you can always call member service. Again, we'll move you up or down the first of the following month that you call. So nice flexibility with the Medigap plans. Any last questions on these before we move on? No. Okay. So those are the plans in Massachusetts. If you turn 65 or you're going on to Medicare outside of Massachusetts, the rest of the country works off of a thing called A through N. Not every state will have all of those letters, but the Medigap will work the same way. Medicare is primary, health plan secondary, picking up the 20%. You're looking at the premium to see what other deductibles it picks up. But what you do want to know in other states is that flexibility that I mentioned in Massachusetts isn't always there. It's not that you can move up or down. They might have some age ratings or different underwriting guidelines. So Massachusetts is a lot more flexible than some other states regarding those supplement plans.
Could I just clarify, or help, you could help me clarify then? So going into signing up for Medicare and being after that 2020 date, January 1st, 2020 date, eligible. In Massachusetts, whether it's Blue Cross, I don't know, Tufts or whatever, other kind, we only have those two choices.
You got it.
Of that. And
Yeah.
Okay.
Yeah.
So if in Massachusetts, if you're new to Medicare now, you know, you don't have this whole chart to look at. You just have these two choices, and which is better because they're really comprehensive compared to, makes it easier, yeah. So, all right. So now what we're going to do is talk about prescription drug coverage. So it can be confusing because you might think, well, I went to Social Security, I signed up for Medicare A and B, I'm going to call Social Security and say, give me Medicare Part D. But there's no such thing as just saying, give me Medicare Part D. Part D is always through a private insurance company, and what you pay for Part D is what that private insurance company is charging. So if you're buying what we call a standalone Part D plan, they can range anywhere from in the single digits to over $100-something a month. Average Part D plan nationwide is about $35, but everybody's going to have a different situation based on your medications. So it can be a lot of work to call every company, check your medications, see how the math works out. So luckily you don't need to do that. You can go on to Medicare.gov. You can call Medicare. You can call Mass Medline or Mass College of Pharmacy. You can make an appointment with a SHINE counselor at the local Council on Aging in Norfolk. They're going to put your medications in the computer system. They will tell you the best Part D plan to buy based on your medications. Because at the very end of the day, it doesn't matter if you're paying $10 or $50 a month, you want a plan that covers your medication, that you're going to pay the lowest premium, the lowest cost out of your pocket, which means premium and copays. And then the next question might be, well, I don't take any medications, so I have to take a Part D plan. You never have to take a Part D plan, but if you don't have what the government calls creditable coverage, prescription drug coverage as good or better than a Part D plan, and you don't take it when you're initially eligible to do so, if you later on want to get onto one at an open enrollment period, you'd get a late enrollment penalty. So not to scare anybody, if you're still actively working and have coverage through your employer, that's most likely creditable coverage. But if you say, I'm going on Medicare, I'm taking a supplement, I'm just going to wait until I need the Part D to take it, that's how people can get that penalty. No matter which Part D plan you buy, all companies are going to follow a standard outline of coverage that's set by the Center for Medicare and Medicaid Services. And the coverage levels are going to be called the initial coverage, the coverage gap, and catastrophic. So every company is going to have a different list of drugs that they cover, their formulary, and how they classify them. They might have some different pharmacies, different membership, and all that factors into the premiums of the Part D plan. But the model is not going to change. So the model in 2023 is that some plans might have a deductible, some plans might not. If they have any form of deductible, it can never be more than $505. The next thing would be, the next thing would be the initial coverage. And this works very different than what you have while you're working. So if you're still working, you've probably gone to the pharmacy and you might pay $10 to take home your medication, and you never cared if that medication cost $50 or $500. You just cared about your copayment. But as soon as you go onto a Part D plan, you're getting this set allotment, but what they're subtracting from that allotment is the total cost of the medication. So really what the pharmacist is charging. So let's take the example, you took a Part D plan, maybe you have a thyroid medication, Levoxyl. You look up the medication in the formulary, it says, okay, it's tier 1 on your plan, tier 1 means $10. So you go into the pharmacy, you pick up your medication, you pay $10 to take it home. But if the pharmacist was charging $100 for that medication, you paid $10, the plan paid $90, but nobody cares who paid what in relation to that $4,660. So they're subtracting the full $100 from it. Now you have $4,560 left to spend. So they're always debiting down the full cost. Maybe you only have $1,000 worth of medication. If you do, you're under that $4,660. It's going to feel like your employer plan. You're just paying the co-payments. But if you have more than that, let's say you have $5,000, $6,000 worth of medication, eventually you're going to use up that $4,660. Then you enter the next level of coverage called the coverage gap. And at that point in time, you start to pay 25% of the cost of your medication. So you just continue to pay that until the end of the calendar year, and then it simply resets with the new allotment of money. But for some people, they're going to say, well, I have $10,000, $20,000, $30,000 worth of medication. That 25% is worrisome to me. That's where that last level of coverage comes in that says, if by paying your deductible, your co-payments, those 25% in the coverage gap, if out of your pocket you ever spend $7,400, then for the remainder of that year, the plan kicks back in and covers you at 95%, and you pay 5%. So that's how every Part D plan will work, whether you pay $10 a month for it or $100 a month for it. Any questions on that? No? Okay. So I'm just going to show you what we've talked about so far. We've done all the hard work. Now the rest of the presentation is pretty easy, but we talked about Medicare $164.90 for most people. Then we talked about a supplement plan, $130 to $230, depending on the types of plan, the supplement that you buy. It didn't include prescription, so if you wanted a prescription, you're looking to a private insurance company for that. Now, at this point in the presentation, sometimes people are saying, oh my goodness, I thought Medicare was free and covered everything. So if you feel that way and think, oh, this is a lot of money, hold off, because we are going to talk about the Medicare Advantage plans, which are typically lower premium. But there's other people that might be listening that say, oh my goodness, thank God I was going to continue to work because I was so worried about my medical coverage. And now I know, let's say for $190-something in a deductible, I can go to any doctor, any hospital, and after that Part B deductible, the $226, everything is covered. Chemotherapy, radiation, MRI. So that's why I was trying to say earlier that with Medicare plans, there is a plan that's going to meet everybody's need. So if you have a need, you can find a plan that's going to meet that. Sometimes it's a very clear path, and other times you're just lucky enough that both pathways will work for you and you just do the weights and balances that make sense for you. So now we're going to move on to the Medicare Advantage, and just keep in mind you still always need your Medicare. You never stop paying that Medicare. You always need Medicare to enroll into one of these private health plans. So again, these are the HMOs, the PPOs. These are the ones you're seeing on TV, zero premium. And I think it's important to explain how they work. so people can understand how a plan is offered at a lower premium. So what happens if you join a Medicare HMO or PPO plan? Medicare is going to send the health plan a set amount of money every month for every member that comes onto that plan. You're also going to send us your monthly premium if there is one. So we get this Medicare money, your monthly premium, we pool it all together, then we contract with doctors and hospitals. We give you all of your Medicare covered benefits, plus additional benefits that Medicare doesn't cover. So now these plans add in money towards glasses, dental, hearing aid coverage. The drug coverage is embedded in these plans. So you're not going out and buying a separate Part D plan. That same model is just embedded in the plan design. In exchange for that, now when you go to those doctors or those hospitals, you no longer show your Medicare card, you just show your one healthcare card. They're going to bill the healthcare company, we're going to pay the claims out of that pool of funds, but you're always going to pay a co-payment and cost along the way. So it's going to feel like your work plans. I'm not sure. Let's see, there we go. So they'll feel like your work plans. One card, pay co-payments. You're never going to lose Medicare benefits. You always still have Medicare benefits, but all the figures that we talked about earlier, they all go away. Now it's like the same thing as your work. You're going to look at the monthly premium, and then you're going to say, when I go to the doctor, what do I pay? Is it $10? Is it $20? When I go to the specialist, what do I pay? What do I pay when I go to the ER? So it's all those co-payments or co-insurances. The types of plans that are going to be available to you are Medicare HMOs and PPOs. HMO is a health maintenance organization. When you choose an HMO, you're going to pick a primary care doctor, and that doctor refers you on for your specialty care. A PPO is a preferred provider organization. You don't have to stay in network and get referrals. Typically, if you stay in network, your co-payments are slightly less, but you can go out of network to any Medicare provider. So a little bit more freedom, and you don't need those referrals. All of these plans, medical, prescriptions, extra, just at Blue Cross alone, we have 4 Medicare HMOs. We have 3 Medicare PPOs. If you go to a different carrier, they're going to have that same type of portfolio. So it's going to be a lot of choices for you. Again, you're looking at just the summary of benefits, thinking which type of plan is going to work best for me. So let me just give you an example of like a PPO plan. Let's say you take a 0 PPO. And you say, last year I went to my doctor and I saw a specialist 10 times. That's all I did. So you look at the PPO, you say, how much does it cost to see a specialist? And in this example, we're going to say $50. So you saw a specialist last year 10 times. You're going to see one this year 10 times, 50 times 10. You've paid $500 out of your pocket. And that's going to include your medical, your prescriptions, money towards glasses, dental, so a whole bunch of extra services. So that person made out great on that plan. If their year changed dramatically, and now they're in and out of the hospital, skilled nursing, labs, x-rays, MRIs, they keep paying those co-payments as they go. All of these plans will always have an out-of-pocket max for Medicare covered services. And that's something that you can check on each one of the plans that you look at. So maybe a 0 plan, you might be thinking around $6,000. That would be your worst case scenario, the out-of-pocket max. Most people never hit it, but it's there as a protection for you. So those are some of the things you can think about with the Medicare Advantage: lower premium, medical, prescriptions, pay as you go. What's that out-of-pocket max for those Medicare covered services? The out-of-pocket max is, the drug coverage isn't going towards that. It's still functioning on that same model that we went through earlier. It's just embedded in the plan. The nice thing about all of this is that you can pick a plan based on your current situation. It's not, you're not picking a plan for life. You can always change your plans. When you first go on to Medicare, everything's opened up to you. After that, you can relook at your plan every October 15th through December 7th and make whatever type of changes you want for January 1st. If you're on a Medicare Advantage plan, one of those HMOs and PPOs, come January 1st, you have one extra time to look at it every year from January through March 31st and say, did I make the right decision? Do I want to change once? Or so you can do that. Special enrollment, moving in or out of the service area, residing in a long-term care setting. I always say we could spend 20 minutes on this slide. We don't need to. If you ever find yourself on the wrong plan in the middle of the year, don't sit there. Go down to Shine, call the health plan, see if you qualify for a special enrollment. If you do, they will help you find it. If not, you know you can change every calendar year, October 15th through December 7th. This next slide is just a resource slide. Earlier I mentioned that Medicare Part B is $164.90 for most people. If you are in a higher income bracket, which means $97,000 as an individual or $194,000 as a married couple, your Part B starts to go up, and also your Medicare Part D, there's a surcharge. They're looking at your last tax return to determine that. So if you do need to pay more, it doesn't mean it's always more for life. Every year they relook at your tax return and change that premium for January 1st. Some of you might say, well, I was making that, but now I've just retired, and that's a life event, so you can always appeal that through Social Security. If you do nothing, it will eventually change with the next tax return, but you can appeal that if you don't want to pay the higher premium. And here are some helpful resources. Here's Medicare, Social Security, Shine. The Shine number is here, but you can call, usually call the Council on Aging, but we know that they're still dealing with.
We still have the same number. We're working at the town hall now.
Okay.
So we're, 9 to 4, 5 days a week. You can call us.
9 to 4. Great. So call
Monday through Friday.
Monday through Friday. You can call the Council on Aging.
Yeah, and
they'll connect you with Shine.
Yeah, and Shine comes through HESCO in our area.
Great. And if you don't want to meet in person, you're just looking for that help for drug coverage, you can always call Mass Medline. They're a group of pharmacy students. They'll do the same. They'll put your medications in the computer system, help you find the best Part D. Also, see if you qualify for any assistance programs. We have a great assistance program in the state of Massachusetts called Prescription Advantage. So if you ever get into that coverage gap, when I was saying, oh, what if you have $5,000, $6,000, $7,000 worth of medication? Again, call the Council on Aging, meet with Shine. There's assistance programs out there that help with that information or to lower your cost. And the last number is the Blue Cross number in our Blue Cross website. We have a lot of educational materials on our site about Medicare. We also have our product information, so if you're looking for our product information, it's there. We also do webinars almost every day on our products. We're out in the community doing product presentations, so there's no shortage to get that product information, but that's not what today was. It's really just for trying to, when you do get it, you'll be able to really sort through that information. And if you're looking for a different carrier, they're going to have the same type of information on their website. You can certainly go onto webinars to hear that product information. That is it for the Medicare section. The next section only takes a minute or two to go through. But any last questions on Medicare?
Sure. I have a question. If you're on an Advantage plan, when or why would you ever need a Medicare plan?
If you're on a Medicare Advantage plan, when or why would you ever need a Medigap plan? So I know you're not asking that, but just to be clear, you never need them together. It's always separate. But if you're on a Medicare Advantage plan and that year you're on it and you keep paying co-payments and you're saying, what? I keep paying. You might want to say, well, let me step back and maybe look at that supplement plan because maybe I'll just pay a higher premium and then have no co-payments. So, if you're ever unhappy with the plan that you're on, there's probably a different plan for you. Just like, let's say you were on a supplement and you're like, why am I paying this $200 a month? I've never gone to the doctor. And say, well, you can pay it. And then, if anything comes up, you're covered, but maybe that person's like, yeah, but my friend is paying nothing and they have money towards glasses and dental. So everybody has their own thing that's going to make sense for them. And if you're unhappy, know that there's another option. If you're happy, you probably found the right plan for yourself. So great question.
Another quick question. The Medicare Advantage plans, are you purchasing that through Medicare or through the insurance company? Who's handling it?
Sure. So how do you purchase a Medicare Advantage plan? You can purchase it either way. You can call Social Security. You can tell them, I want to join such and such a plan, and they can do that enrollment for you. But my suggestion would be to call the company directly. So you can enroll, like let's say we're going to take a Blue Cross Medicare Advantage plan. For us, you could call us, you can enroll on the phone, you can enroll online, we can send you a sales packet, you fill it out, you send in the application. It's just, you can do it either way, but I don't know why go through somebody else to get to somebody. So just if it's Blue Cross or somebody else, you can just enroll through them. It's an easy process. All right, so the last section, only going to take a minute to go through, and this is, well, what if I need coverage before Medicare eligibility? What you're going to choose is really going to depend on what you have access to. It's either going to be your spouse or partner plan, COBRA, or direct pay. We have them in order of what typically works best for most people. The spouse or partner plan, this example might be you're still working and now you're retiring. You had your insurance through your company, your spouse was on it, but your spouse is still working. Well, you've just lost your coverage. That's a qualifying event for you to go onto your spouse's plan. That's usually the best bet because if a company's offering coverage, they're paying at least 50% of the premium. Not everybody's going to have that option, so then you would be looking at COBRA, which is temporary continuation of your group coverage. COBRA is nice and easy because it's the same exact plan that you had while you were working, so you're familiar with it. But now you're going to pay 100% or 102% of that premium, so the company's no longer chipping in. Employees are generally eligible for up to 18 months. Spouse or dependent children can be anywhere from 18 to 36 months. So now you know your COBRA, you know your health plan, you know the rate. You can shop it in what we call the direct pay market. That means you're calling Blue Cross, you're calling another company. You're saying, I want individual, couple, family type coverage. They're going to take the age of the oldest person in your group and your zip code, and you'll have a list of quotes. Just to give you an idea, if you're 63, looking for an average plan, you're probably looking at about $800, $900 a month. So it is an expensive time frame for a lot of people. Usually the COBRA is going to be better, not always the case. If you qualify for any type of subsidy, you want to go through the Mass Health Connector to buy a subsidized plan, because then you're going to get an affordable plan with affordable premiums. It's not low income and they don't look at your assets, so don't cross it off without looking because you might qualify for the subsidized plans. And that is it. So thank you so much, everybody. Thank you. I hope it was helpful. And I'll be here if you have any personal questions. So thank you.